State lawmakers, for the most part, aligned on the issues they're going to tackle this session. And as things get underway, Governor Josh Green outlining his plans. He joins me now in studio. Good morning, Governor.
Morning.
Yesterday, you delivered your third State of the State address and several recurring issues there. You talked about cost of living and housing, affordability, public safety, and healthcare. And let's start with healthcare.
Sure.
We have a multifaceted issue there. One concern, of course, the overall affordability. We are also seeing a stressed group of healthcare workers right now. So labor unions, we've been talking about that a lot. We've seen it in several different hospitals. Right now, Wilcox on Kauai is still working through theirs. Is how do we address these two different things and how do they work together?
Sure. So I boiled it down to the common denominator, which is having enough healthcare providers, personnel here in Hawaii to do the work, to be able to afford to be in Hawaii and to stay here. So that's what the HELP program is all about, which is our loan forgiveness program. It came out of experiences I had as a doctor coming to Hawaii where my loans were repaid by the federal government to commit to 4 years in Hawaii. Now we have the HELP program, which provides scholarships for about 600 healthcare providers every year. It costs $15 million a year, plus Mark Benioff, who's very generous and a good friend, has been giving us an additional $5 million a year to help on Big Island. What we do is we repay the debt of social workers, psychologists, psychiatrists, surgeons, anyone, if they stay in Hawaii and care for our people, and that will take down the pressure. I should say nurses too, for sure. That will take down the pressure of recruiting, and they can cover the shifts much more easily, and that extra resource affords them the ability to, have a house.
So do you think we're doing enough right now to create a balance between those two, or is there still a very long road ahead?
Well, there's a road, but there's good news here. I didn't put this in the speech, but a year ago we had a 17% shortage and it dropped to 14% shortage. Okay. So 3% in 1 year just with this program alone. Plus, they're negotiating new contracts, and I'm fortifying hospitals with better facility dollars and Medicaid dollars. So we made a lot of progress just in the first couple of years. Over the course of 5 to 7 years, we will reach functional zero shortage. And that's because the legislature has been so supportive, and this HELP program works really well.
Well, in an effort to tackle affordability, moving on here, a large income tax cut is coming through that will reduce state collections. What about doing away with the state income tax entirely?
Well, that's a bridge too far, of course, but what we're doing is we are totally changing the way we do state taxes. So we're going from like the fourth highest tax state down to the second lowest tax state in the country. You can't have no taxes. That's kind of too much. But what will happen is several things. Right now, about 25% of our state, for people who are pretty poor, pay no state tax, or they're young people and they just don't make very much money. That will go up to 40% over the course of these 7 years. So 40% of our residents will pay no state tax whatsoever. And those are the people that are Alice families, families living paycheck to paycheck. That's really what you want. You don't want people who are making $300,000, $400,000, $500,000 a year paying no state tax, because you have to have nurses, you have to have hospitals, you have to have schools. We don't want to do away with those things, I presume, right? We need them. I'm of course being, somewhat sarcastic here, but you have to have a tax base, but you have it based on where people can afford it. And our Alice families need to afford housing. All of that money churns through the economy. That's why our economy is still ticking along in spite of the tax breaks. And we will ultimately cut $5.6 billion in taxes. I'll probably be one of the very few Democrats that cuts taxes steeply.
And of course, we're seeing a lot of changes in Washington, D.C. right now. Several alerts coming out this morning from the White House and Donald Trump's administration. How do you see these changes playing out here in Hawaii, and how will that impact us?
Well, I pick my battles carefully. I'm not an oppositional rebel. I'm here to govern Hawaii and to care for people. I personally disagree with some of the decisions that are being made, but when I take up a fight, it's because I have experience. And let's use an example, RFK. I went to Washington at many people's invitation. I'll probably have to go back again if they need me to testify on his nomination. But in that case, he's not a good choice for America. He's going to torpedo vaccination programs like he did in Samoa. Our kids are going to see measles outbreaks, mumps outbreaks. You will see polio return. And interestingly, the Republicans I spoke to half Republicans, half Democrats when I was in D.C., they were not in favor of his nomination for the most part, for many different reasons. Some of them because they're much more conservative than he. Others because they were really taking to heart what I said about vaccinations. I think the president has won the election. He has to make his decisions, and I hope he will govern in a caring and compassionate way. He has a different style than I do. Those are his choices to make. Elections have consequences, and if he cuts a bunch of people out of government, those are his choices. I don't love them. I will protect our people the ways I can, and I will protect our Medicaid budget. I will protect our social programs. I will make sure that we are sensible in how we govern. And interestingly, I'm actually kind of a nonpartisan guy when it comes to these policies. That's why you hear like I'm cutting taxes, but maintaining scholarships for healthcare providers. You have to fit your decisions to your own state.
And I just want to ask, because we did have some state lawmakers yesterday talk about federal funding cuts.
Sure.
We didn't address that in the state of the state, of course, but how do we operate with those potentially being coming? And we're expecting a lot of money in several fronts.
Yeah, so I anticipated that. In 2023, I cut $1 billion from the budget that had been proposed, and then in 2024, $500 million, and I kept that in our savings accounts. We also kept our rainy day fund intact at $1.5 billion. So we have a surplus of $1 billion. If the federal government, in this case, the Trump administration, cuts Medicaid to pay for taxes for very rich people, I will be able to fill in that gap because we have this $1 billion surplus. The estimated cuts could be as high as $300 million, and that's for people who are living kind of on the edge. These are mostly women and children who don't have health care coverage. So I don't think we should walk away from that. It's not prudent fiscally either, because then people go to the emergency department where costs are 5 or 10 times as high. So I'll make smart decisions, I hope, about the budget, but I did leave us some room to maneuver in case of this circumstance. So I've been anticipating this for 2 years as a possibility. We also have to deal with climate change. As you know, I've proposed lots of legislation and ideas that would apply fees to people who are traveling here, impact fees, so it's not a tax burden for our local people. So that is the approach. I understand that people are going to have some differences of opinion. I note that some of the periodicals, I think maybe it was the Civil Beat, came out and said that I should have just railed against Donald Trump. I'm here to help people as a governor, and I don't particularly want to get into fights just for the purpose of getting into the fight. I'm going to take up fights when it's going to be, first of all, something I'm experienced about, and second, something that would affect our people directly. I'll always push back if it's going to hurt our people.
Governor Green, thank you once again for joining us this morning and really diving deep with us on all of that.
Love it.